Hi, good evening. This is Miguel Matute. I'm an occupational therapy student from the University of St. Augustine, Miami, Florida. And here's my patient, Lucy. So today, me and Lucy, we're gonna go over some different transfers. And Lucy, there's a reason why we do transfers. Transfers are done for the purpose of getting the patient ready for discharge. So I want you to be able to be as independent as possible. So having a transfer done is like getting out from the wheelchair to the mat or getting off from the wheelchair to the bed, right? So that's called independent. So before we start, I'm gonna go ahead and wash my hands. So this is done in 7 different steps. I'm gonna go here, interlace my fingers, dorsal of my hands, circle my fingers on each hand individually. I'm gonna do a little rubbing here, rub my fingers, my nails, each finger, each hand, sorry. Circle my thumbs, and then finally getting done with my wrist. So let's go over a few key points, very important. So always make sure your patient has the brakes on. So I have the brakes are on, brakes are here, good. So my patient have her legs on the footrest, so that's fine. And then I'm gonna ask my patient for informed consent, basically permission to perform the transfer. Is that okay?
Yeah.
So for safety purposes, I'm gonna have my patient with a gait belt on. So I want you to go ahead, Lucy, and lean forward. So I'm putting this, lean forward, just lean forward, yeah, lean forward. So bring your elbows up. Good. I want to make sure that you have your gait belt underneath your belly button, on the patient's belly button. So right there, that's tight enough. And I always want to make sure if you have any left over, you can always go under and over. Right, so let me go ahead and remove the swim leg for you. So I'm gonna kneel down. Let's pretend we have one here. So I always put this way away from the wheelchair so there won't be no accident. I take the one here and put it away. Good. So the first transfer that I want to demonstrate is called the standing assisted pivot transfer. This is mainly done when the patient have unilateral weakness or they have any sort of surgery. Let's pretend my patient have a total knee replacement on the right hand side. So what I'm going to do before I perform what is called a blocking technique is basically I put my foot lateral to her foot and I cross my tibia over her tibia. That's called the blocking technique, right? So before we do that, I'm gonna ask my patient to scoot forward over the edge of the wheelchair a little bit. Good, that's good. That's good. So blocking technique, my foot goes lateral to her foot. My tibia goes over her tibia. AP stand. On the count of 3, Lucy, I want you to rock back and forth. We're gonna stand up, and then once you're standing up, we go from there, okay? And then we're gonna push down on the armrest, right? So grab the bell always with the supinated grip. On the count of 3, 1, 2, and 3. Up. So move your left leg forward. Keep turning, keep turning, keep turning, keep turning. Stay right there. So do you feel the back of your legs making contact with the bed already?
Mm-hmm.
You do? So okay, I want you to go ahead and reach down with your arms. Reach down, slow, reach. So notice that I never lose contact with my patient. So I keep the blocking technique all the way through it. So before we finish, so always secure your patient and give your patient the call up button. So hold the call up button. That's good. That's transfer number 1. So let's perform the second transfer. So stand up, sit on the wheelchair, and we're going to do the standing dependent pivot transfer. This is basically done when the patient has a bilateral weakness on both legs. So Lucy, move your legs forward, your legs. Yeah, put your legs together. Good. So same procedure. So I'm gonna hit Lucy and I want you to scoot forward over the edge of the chair. Scoot forward. Good, right there. So I'm gonna block both knees. right? So before I do this, I'm gonna ask my patient to move her heels in the direction she's gonna be sitting at. So right here, and right, good. So I'm gonna do the blocking technique here again. So secure the patient. So again, the count of 3, we're gonna go 1, 2, 3, and then pivot, right? So we're standing up and then pivot. 1, 2, and 3. Just pivot. So reach down with the hands, good. Right there. So never lift your patient left alone. So always secure your patient and use the call up button. Good. That was the second transfer. Let's go ahead and do the third transfer. So sit back down. And let's do a one person dependent transfer. So usually when you do this type of transfer, the patient has a lot of weakness. So we'll see. I'm gonna go ahead and place one of my hands here on the gait belt with the arm supinated. I want you to look over my shoulder. Right, with this arm right here, just go around here. I'm gonna grab my patient underneath her leg. So I want you to lean over this side and 4. So on the count of 3, 1, 2, 3. Good. This leg, this hand. So lean over this side, look over my shoulder. Right here, 1, 2, 3. Good. That's good. So I'm gonna go ahead now. I'm gonna blow my patient's knee. So bring your knees together. Good. And if you want, you can always use the same technique. So heels pointing to the direction where you're gonna be moving the patient. So on the count of 3, we're gonna do 1, 2, 3, rocking back and forth. 1, 2, and 3. So reach down, slow. Good. So you give your patient your call up button. Good. Let's demonstrate the last transfer. It's called the sliding board transfer. So go ahead, sit down. This last transfer called the sliding board transfer is usually done when the patient has an amputee patient or has a spinal cord injury. For the purpose of the video, I'm going to do the best that I can. This is my sliding board. This is what we call the armrest. So I'm going to go ahead and move the armrest. Put it away. And then that's my sliding board, right? I'm not going to use it right now, but this right here is going to be right here. So Lucy, I'm going to ask you to lean forward. I'm going to block my patient's knee. So lean forward, and then you're going to scoot over to the right. So I'm going to place the sliding board underneath her leg. So bring your leg out for me. Good. So the sliding board is all the way through here. It's kind of short, but let's pretend like the sliding board comes all the way out. So Lucy, I'm going to head. So put your hand here on the sliding board. Never put your hands on the corner or underneath the sliding board because you're going to smash your fingers. But let's pretend the sliding board is all the way through, right? That's okay. So on the count of 3, right? We're going to go 1, 2, 3, rocking back and forth, and you're going to be sliding over the side, and then you're going to be pushing down with the arm, right? So 1, 2, and 3. Good. Sit down on the board right there. On the board. Sit down on the board. Good. So I'm going to go ahead, and again I'm going to slide you over. 1, 2, 3. Good. So move the sliding board out of my patient's way. Right there. Put your hands here. Make sure your trunk is stable, and then you give your patient your call up button. Good. And those are the 4 different transfers. So thanks for watching my video. Thank you.